Thank you, Doctor, for your presentation and for the introduction. First of all, I will talk today about the power and promise of AI in breast imaging. The goal and the topics taken today is introduction, radiomics, applications of AI, some cases, limitations, and my home message. As we all know, the cancer is a disease that continues to plague in our modern society. Among all types of cancer, the breast cancer is now the most common type of cancer occurring in women worldwide. Proper screening for early diagnosis and treatment becomes a major factor when fighting the disease, and AI continues to revolutionize the various spheres of our lives with its numerous applications, and especially in the healthcare process. Here's an example for some applications of AI in the healthcare process, including medical robots, chronic health records, some clinical trials, outbreak prediction, and medical image diagnosis, as well as personalized medicine. First, we have to learn how does the AI work. It works in some data sets, okay? It should allow a machine learning protocol. This is a small, simple diagram showing the different algorithms and the different methods used in the field of AI, including the machine learning, the deep learning, neural networks, convolutional neural networks as well, where it mainly depends on how much data sets are applied to the software that will be used in the diagnosis. And the most common one used in the clinical practice is the deep learning model that use a huge computing power and a huge training data sets. Our goal in the breast radiology is to improve diagnosis and get better image quality. We usually had the 2D image, and then it was evolved to the 3D image for better image delineation and detection of the lesion. And the AI, surprisingly, it was aided for the computer-assisted radiologist in the detection system using the traditional machine learning techniques that have been FDA approved for use in mammography since 1998. Here's an example, the input or the data given to the mammographic image. It passed by many layers and many steps in its pathway, including convolutional layers, and then dividing the breast into some regions in a region proposal network that then is identified by a region pooling and classified later on into malignant, benign, or normal according to the output given. In the radiology department in Ain Shams University, here's the pathway of the patient. She came to the screening, for example, and had her history, and then she had her 2D image, and then the images were displayed on the digitalized system and then analyzed by a software analysis system. Here we had the aid of the Faculty of Computer Science for detecting and generating this model of AI, giving a generated mammographic image with an AI, a combined AI mammographic image. So the roles of AI in early cancer detection and multimodality screening includes detection of the lesion, diagnosis, discrimination or characterization of the lesion, and finally the breast cancer risk assessment calculator. Mammographic sensitivity, as we all know, declines significantly with increasing the breast density and is independently higher in older women with dense breasts. Additionally, the screening ultrasound significantly increased the detection of small cancers. AI in breast cancer screening has a major transformation role that has improved the quality of the predictions of the models and can be used as a second reader for the mammographic images. AI-based CAD has a great scope to reach the high sensitivity. It can be used to reduce the reading time in DBT, for example, and can be used as a pre-screening tool for the exclusion of the low-risk mammograms and hence decrease the false and the recall rates and the false negatives and false positives tests. So we have 3 scenarios for AI in early cancer detection and multimodality screening. Either AI as a standalone reader or AI as an independent second reader to the human radiologist or AI as an assistant to the radiologist. These are many studies had discussed this entity. Some of them here I can show the changes in cancer detection and the false positive recall in mammography using AI. Done in 2020 was published, and its conclusion was that the AI achieved a cancer detection accuracy highly comparable to an average breast radiologist. Another study named the Standalone AI for Breast Cancer Detection at Screening Digital Mammography and DBT. It was published in the RSNA in 2023, where its conclusion was that the standalone AI performance gave 0.94. The radiologist performance was 0.81 without AI and 0.88 with the AI. So the AI showed a better diagnostic performance in cancer detection comparable to the radiologist alone. In early cancer detection and cancer screening, we had this example where the case had a mass in her left breast upper outer quadrant, which was highly significant in the ultrasound, but the AI gave us a confident diagnosis by the color map and the scoring system, which was high. So in other modality like the digital breast tomosynthesis, we can detect the lesion. Either it's a mass segmentation or calcification or any breast density elsewhere, as well as for diagnosis and prognosis and characterization and assessment calculator, as we mentioned before. Here, the tomosynthesis, as we all know, it overcome the masking effect of the breast density and the 2D image into many slices. We cut the breast into many slices, up to 46 slices and more. It can easily delineate the lesion and overcome the masking effect. Here is an example for applying the AI for the digital breast tomosynthesis that was published in Radiographics very recently for better localization and classification of abnormal imaging findings here in designed to place the bounding boxes, either a blue box for the high confidence score of malignancy and the yellow box for the low confidence score of malignancy. And this gives better examines acquisition, reduction in the time of examination and reduction in the reading time, as well as it increased the conspicuity of the malignancies, as mentioned in by our speakers today, for the importance of digital breast tomosynthesis in imaging. And finally, it gives better visualization and processing of the images, so thus efficient protocol management and better reporting of the cases. Not only this, but also the digital breast tomosynthesis gave us here, for example, using the AI with the DBT, there was a mass already seen as arrowed by the black arrow, is a dense speculated malignant mass, but also the white arrow was marking for some few microcalcifications that were highly suspicious for malignancy. But the AI gave us another idea. It was a color code of green color that was for benign calcifications, which was confirmed by biopsy later on to be benign calcifications. As we all know, the ultrasound, which is widely used in our daily and clinical practice, as it is a safe procedure, very cheap and easy to use. And it's used mainly for identification, classification of benign versus malignant lesions, as well as for axillary lymph node assessment. But it has inter-observer variability, and interpretation of ultrasound images is different, even among experts. That may lead to high rate of false positives and unnecessary biopsies, as well as unnecessary surgical procedures. So the AI, when applied to the ultrasonography, it allows full mapping of the breast and automatic annotation of the area of interest, as well as feature extraction, so increasing the exam productivity and more confident diagnosis. Here's an interesting study done and published in the British Journal of Radiology, asking about, is the artificial intelligence can replace the ultrasound as a complementary tool to the mammography in our diagnosis of breast cancer? And here is an example for the use of AI complementary to the mammography instead of the ultrasonography. It gives us and a diagnosis for this lady that had a lesion, 30 years old lady that had a left breast lump, which was only diagnosed by ultrasonography. It's a malignant lesion, yes, but it not only detect the lesion, but it also, the AI detect another lesion that wasn't detected by the ultrasound, which was a sentinel malignant intramammary lymph node, which was confirmed later on by the surgical biopsy. Here's an example for one of the softwares applied to the AI ultrasound called the S-Detect. The S-Detect CAD AI ultrasound S-Detect, it allows mapping, full mapping of the lesion, feature extraction of the lesion, and gives us an idea about the diagnosis. Here, she's a young lady, 30 years old, came for screening as she was a very high-risk lady. The ultrasound gave a lesion which is irregular in shape, hypoechoic pattern. It might have some possible malignant features, but the AIS detect gave another idea which gives a possibly benign, which was diagnosed and confirmed later on by biopsy to be fibrocystic changes. While applying AI with the breast MRI is very interesting, as we all know that the breast MRI is one of the most diagnostic tests and this highly sensitive test in breast imaging, but applying AI surprisingly gave qualitative and quantitative parameters for applying AI, not only giving and describing the morphological features of the lesion, but also about the vascularity of the lesion, as it can detect the most enhancing part of the lesion and the regions of interest in the part where we can examine, giving a score and giving an index color code, where the QI score is an FDA-approved scoring system called the QI score, which was an FDA-approved for breast MRI that addresses the specificity metric by assisting the radiologist and hence allowing them to differentiate between the cancerous and the non-cancerous lesions. And here for this study, it was mentioned on the monitor as a color code, as I mentioned. It is either a blue color code for persistent enhancement, or a red color code showing washout, or a green color code showing no change. What about AI in risk prediction? As we mentioned that the AI can predict breast cancer risk in mainly, we have many risk factors like the age, the family history, the reproductive history, the breast density, prior breast procedures, as well as the estrogen intake and the lifestyle, for example, the body mass index. This model was done by Barklow, and it was a prediction model to undergo the screening mammography. It was helping to standardize the reporting adjunctive screening related to a software system using the breast density software. It is related to the ACR by RAD's lexicon, giving 4 categories. As we all know, A, B, C, and D are the categories of the breast density. According to this model, using the deep learning model implementation, Lichman, Constance et al. Described the difference between the radiologist and the AI reader, where it was different somehow, and it gave a little bit different examination results. Here, it was found to be high cancer, AI classification, cancer-free exams, highly related and correlated to the human readers. And this is an example for the human reader in comparison to the AI reader, which gave a very high score in agreement, up to 90% between the tool and the AI tool and the 3 human readers. What about the AI in the prognosis and the post-operative follow-up? I will show you some cases that was done in my institute. This is for a 44-year-old lady with a left breast lump. She was diagnosed as carcinoma, done her contrast enhanced mammography, and then she was, by the MDT, underwent a neoadjuvant chemotherapy. 6 months later, after her neoadjuvant chemotherapy, the AI model gave us an intermediate level of abnormality, and her score was 44 according to this this model. Another case, 65 years old lady with very dense breast. She had a right breast speculated irregular mass that was confident for highly suspicious mass lesion by RADS5, and the AI model gave us an elevated level of abnormality up to a score of 92. So it helped, it aided for the diagnosis and was confident by the AI. Another case, 55 years old survivor. She had 1 year post her conservative breast surgery. She had this architectural distortion in her upper outer quadrant, and it was very adjacent to the operative bed. Her ultrasonography delineated a hypoechoic scarring area with features was very highly suspicious, but the AI gave a very low score of abnormality, which was very confident for the lady for her post-operative assessment, and it was beneficial in her treatment plan. So my challenges are in the AI in general is the very high cost of the software. Number two is the data set that should be allowed and put into the software, and matching of this data with the most suitable algorithm that can match the patient's nature of the disease, the patient's race, the patient ethnicity, the gender, as well as the representation of the disease. All in all, training of medical personnel is highly needed to develop these new technologies, as well as validity of the available images and ensure the data protection. So it's an open discussion for the new directions nowadays about the ChatGPT. Is it a threat for our imaging today, and it's our threat in our life today? Is it a threat? We have to discuss it later on. And finally, my take-home message today that is in the state of ongoing improvement. AI is a man-made machine that simulates the human intelligence, so it can be fast, accurate, convenient, reliable, and specific. And it has as well a significant force in the future of breast imaging and a major diagnostic role in breast cancer screening per se. It also can predict the future risk of cancer in some ladies. Some challenges are facing this innovation, like the data validity, the high cost, customizing the most suitable AI model software algorithm. But finally, it's an aiding tool in the hands of radiologists and never replacing them. Thank you so much for your attendance and time today, and thank you, the chairperson. Thank you very much for this. I'm honored to be